My leadership skill questionnaire showed that I am moderate administrative and very high interpersonal and very high conceptual. Scoring very high in interpersonal will help me to lead and manage staff. It's important to understand each staff member individually, as people work differently and have different skill sets. It is also important to understand what is going on in people's lives and show empathy. And if you know what's going on in their lives, then you understand them on a professional level also. My interpersonal skills are also good for handling conflict. I believe in handling conflict immediately before the problem escalates and doing it in a calm manner. My very high scores in conceptual skills place me in an advantage for solving problems. I look at problems as a puzzle and a challenge, and it's very rewarding whenever I resolve issues and solve these problems. Conceptual skills also aid in bringing groups together as a team and bring the team together for a shared common goal would be beneficial in managing a department. My moderate score in administrative shows that I have room for improvement in that area. Understanding how the whole organization runs and effectively managing my resources to meet the vision and mission of the organization would be areas that I feel that I would need help in building leadership skills. And I recently changed jobs, and it's a much smaller company that I'm working at now. So I chose to look at the organizational structure that I just left in a hospital setting. And the hospital was a vertical structure, and the model care practice was team nursing. And some of the advantages to team nursing include staff satisfaction as their skills and capabilities are maximized in a team nursing atmosphere. And another advantage is that the patient has one nurse that has immediate access to all the healthcare providers. And disadvantages to team nursing is the team lead changes daily and the continuity care for the patient is lost. So team nursing requires also, one of the disadvantages, it requires each team member to have a commitment to the team in order for the team to be successful. And I think that team nursing allows for an easy transition into transdisciplinary care. And per the article that I researched in the Medical Care Journal, interdisciplinary care creates a synergistic relationship that produces care that is not possible when we work alone in a silo as an individual. Team huddles used throughout a shift in team nursing. This encourages communication and collaboration, and these skills are beneficial in working in transdisciplinary care team meeting. As a manager, I think my interpersonal and conceptual skills would enable me to effectively manage staffing for my unit by understanding how the staff works independently and also together as a team and understanding each individual's skill sets. I would know what motivates them to be flexible in order to cover needs within the department. And by using my interpersonal skills and knowing each individual staff member, I will know what schedules work best in providing them a good work-life balance. My conceptual skills would help me to be creative in solving staffing problems and dilemmas. And as a nurse manager, I would think that it's imperative to work well with all departments within a hospital. This would help solve problems with patient flow from one department to another. It would also enable for a smoother transition whenever changes to policy within your department also affect another department in some way. By having a good relationship with the other department managers, it would help transition these changes more smoothly. There is also an opportunity to share staff between units when the skill set is to the point where people could change from department to department. And when one department has a lower census and another department has a higher census or call-ins, by developing a good relationship between different managers, it would help facilitate the sharing of staff in order to meet staffing needs between different units. Personally, I prefer working for a vertical organizational structure. In healthcare, nursing specifically can be very specialized, such as ER, OB, critical care, behavioral health, or med-surg. And I think it's important for the leaders or managers of a specific area of nursing to be able to understand the daily functions within their department and the needs that are necessary to provide quality care and the skill set it takes to meet the quality care of the patient population they are managing. This structure also gives a clear line of chain of command to follow for problems or issues within a department that are not resolved. Sometimes in a horizontal structure, it's hard to understand who the next in command was, but in a vertical structure, it's very clear the lines of chain of command. Thank you.